Hi friends, I am Dr. Rupali Jain, consultant neonatologist and pediatrician from Vashi, Navi Mumbai. Today I am here to discuss care of the newborn at home. So whenever a baby is born, it is a very pleasant, joyful time for the family. But with all the pleasant fun comes a lot of responsibilities on the parents to take care of the newborn. Today I will discuss important points that you need to keep in mind while caring for your baby at home. And we can discuss more in detail once on one-to-one basis in the OPD. So first of all, I want to mention is breastfeeding. It is very essential to breastfeed your baby. Every mother should breastfeed their baby, and the family should be very supportive of breastfeeding. But an important thing during breastfeeding is the mother has to ensure there is a proper latchment between the baby and her. Latchment is the attachment between the mother's breast and the baby. It has to be very appropriate, because if the process is painful, she may not be able to continue it for a long time. So the positioning and latchment has to be appropriate, and if painful, medical advice or lactational consultants need to be seen to make sure that the breastfeeding can be continued for a longer time. It is very important to burp your baby after each feed. Burping is like vertically taking the baby on your shoulder and mildly patting the baby till the baby burps out the excess air that the baby has taken in while the breastfeeding. Why is it essential? It is essential because if the baby is not adequately burped, he or she may later pull out some milk, some milk may come out, and that can lead to some choking and vomiting. That can lead to hazardous complications for the baby. So it is very important to burp your baby after each and every feed during the day as well as night. Now third important is stools. Now a well breastfed baby can pass as less as one stool in 10 days to as much as 10 times in a day. Stools can be 10 times in a day. It just has to be the child is not in discomfort, there is no abdominal distension, that the tummy is not coming out, it is not distended. That will make sure that the child is very comfortable. That will make sure that the child is okay. Now initially when the baby is born, the stools are completely blackish, greenish, tar colored. Now as the baby transitions and feeds well, and he or she poops during the day, now the stools usually come to yellowish around 7 to 10 days. So the transition is from the black stools to greenish, dark yellowish, and then yellowish stools. So don't be scared if your child produces black stools on day 1. It is absolutely normal. Now the next important thing is urination. A well breastfed child will urinate around minimum 6 times a day, but a well breastfed will urinate to around 10 to 12 times a day. So if the child, you need to change diapers every hour, every second hour, so please don't be disturbed. It is actually a good thing that is happening. Now next most important thing is care of the umbilical cord. So umbilical cord or the navel cord that is present here is usually attached. You have an umbilical clip that you can see in the newborn. So that clip needs to be careful. It usually falls off around 6 to 7 days of life. Up to 10 days is also okay. You need to make sure whenever you're putting on the diapers to your child, the cord is above and the diaper is folded below the cord. Because what will happen if you fold the diaper above the cord, any urine or stools in the diaper can go and soil the cord, and that can cause infections there. So one important message is to keep the diaper below the cord, and you can just wipe off the cord with the cloth, a damp cloth, and leave it air open to dry off. Next important thing is bathing. Bathing is to be deferred till 24 hours of age. Like in the first day of life, please do not bathe your baby, and after that the bathing can be started. It can be every day, once in 2 days, or twice in a week, depending upon more of the environmental conditions. Now next important thing that you will want to take care is the diapering. So diaper, usually one important thing I've already mentioned is the care of the umbilical cord with diapers. Other thing is the diaper needs to be put. You can use cloth diapers, disposable diapers. Make sure you change them frequently. The child should never be in soiled diapers, because that can always lead to something known as diaper rash. And always give some diaper free time to the baby. where the child is maybe not in any diapers and roaming around in the house, or that would be in an older child, but young child where the child is just kept on a sheet where there is no diapers, so that that area is well exposed to air and dry. It does not remain wet and soggy, which can lead to more infection and diaper rash. So there are many more things that a mother needs to be aware of, like tummy time, what supplements she needs to give to her child, and how do you take care of infantile colic when the child is just crying and crying inconsolably, what do I need to do? But all these can be discussed on one-to-one basis in the OPD. I hope this talk was helpful for you, and we can discuss, I'll prepare more videos on each of these topics to help you handle your baby better. Thank you.